we get some vital signs on him and we get him back to see a doctor.
Suppose you're 5 years old again, and you're very sick or badly injured. Your mother rushes you to the hospital, and now you're scared. Meeting the healthcare needs of children and their families is no small challenge. Christine Johns is Pediatric Center of Excellence Executive for the Alexian Brothers Hospital Network. She's a leader in the effort to try to create a hospital within a hospital at St. Alexius Medical Center by redesigning facilities and processes to improve the service, treatment, and effectiveness of care for children and their families.
It's very important to treat children and adults differently. We like to have unique pediatric areas at our facilities. At both the acute care hospitals, we have a separate pediatric unit. We also have a separate pediatric emergency area, which is called Emergikids at St. Alexis. And we also have a separate pediatric intensive care unit, where the children are separate, of course, from the adults.
Being on a pediatric unit, we have to think small. Things need to be at the level of a child. So when we design the playroom, we want to be able to have sinks that are small enough that the kids can wash their hands without having to get on a step stool or a chair, make it safe for them. The designs of the shelves and cupboards are at the level of a child so they can reach a toy or a game safely. The decorations are important. We want it to be soothing and inviting, not scary and sterile looking.
Special care is taken to design the look and feel of the rooms to lower the child's anxiety level. St. Alexius even has a child life specialist on staff to help coordinate everything from facility layout to staff development. This progressive approach is part of a holistic healthcare philosophy that is fostered by the Alexian Brothers. The Alexian Brothers are a 700-year-old Catholic order devoted to caring for the sick, the poor, the elderly, and the neglected. They're planning an ambitious $352 million investment in the physical restructuring of the existing hospital campuses to create the finest healthcare network in the region. In order to deliver the finest healthcare with the best quality treatment and service, they'll need the best operations management. The Alexian Brothers first examined the healthcare needs of the community and did a competitive analysis. Downtown Chicago teaching hospitals have excellent reputations, but commuting into the city is often difficult for families. Smaller suburban hospitals generally lack subspecialties like neurology, rehabilitation, pediatric oncology, and a cardiac catheter lab. This analysis led Alexian Brothers Hospital Network to create 8 centers of excellence to ensure that the community would have access to the latest medical, surgical, and diagnostic advances close to home. Pediatrics is considered a most important center because it's often the gateway for families as they establish a relationship with the hospital. An operating plan was developed for pediatrics. They analyzed the current procedures and visited other new hospitals to see the latest designs in use.
What we found out is that, of course, patients would rather have private rooms. We found out that expediting the admission and discharge procedure was very important. When a sick patients arrive in the hospital, it's important that they get admitted to their floor or to their bed as soon as possible so medical care can start as soon as possible. And when the patient is ready to be discharged home, we found out that accommodating those needs was very important. Not only the patient wants to go home, the family wants to go home, but it also frees up the bed early in the day for the next patient. This is very especially important during the winter when we have a fair amount of pediatric patients that are admitted every day. It's very important to maintain the flow of patients going very smoothly and efficiently.
New facility designs emerged from this thorough analysis. The new pediatrics floor will include an upgrade from semi-private to private rooms, which enables better infection control and better privacy, especially when parents spend the night with their child. The pediatrics floor will again feature a circular layout, which gives a clear view of all rooms from the nursing station. It also makes for easier communication between staffers. But the circular layout is a bit loud, so noise control features are being considered. A medication room will be added so nurses can prepare medications away from the distractions surrounding the nursing station and minimize the potential for error. Infection control supplies, currently stored on a cart outside each room, along with safety and emergency supplies, will be stored in wall cabinets beside each patient room. The design of the new pediatric emergency department will also have separate exam rooms and advanced wiring for future electronic equipment and wireless technology. A new central monitoring system will show vital signs for all patients in one control room, thus reducing the need for frequent nurse visits to check patient vital sign monitors. A separate pediatric triage or check-in area is also in the plans. This will provide children more security and protection from potential dangers. Each department is equipped with a special pediatric crash cart.
This is the crash cart. It's used for an emergent need for resuscitation. The cart is stocked with pediatric supplies and the drawers are labeled accordingly. The computer on top measures vital signs during the emergency. And the cart is kept locked at all times. We open the cart during the emergency, and then within an hour after the emergency, the cart is restocked by the nurse and then relocked with the nurse and the pharmacist.
Hospitals must face the challenge of matching current and future patient needs with new equipment and procedures. Training staff to use new equipment and to implement new procedures is a whole other challenge. Monthly unit meetings include training on the latest techniques.
Any kind of redness or swelling anywhere that we documented on this form.
This is the central monitor. It allows us to see the vital signs of all the patients in the rooms, in the ICU rooms.
The new facility will use more advanced systems to monitor vital signs. Many staffers will need to be trained to use this important new technology before the new monitors are put into critical situations.
We work as a team in the education department, so what actually happens is we attend in-services to update ourselves, and then we in turn will be updating the staff with the new monitors, especially with the new monitors that are coming. I think we're going to do it house-wide. And we're planning to choose a date like a month before when the new monitors come out and do hands-on.
One of the things that we're also excited about with the build-out in the new facilities is the development of and bringing in more sophisticated monitoring equipment in the pediatric emergency department. There's kind of two phases to that. There's increasing better monitoring for the patient at the bedside, which includes bedside monitoring for oxygen and even CO2 monitoring, heart monitors. The other thing that we're also excited is a patient tracking system that we're going to be developing, or actually it's not so much developing, but we're going to be purchasing in the next several years. And it's a patient tracking system in that the patient, as soon as they arrive in the pediatric emergency department, from the time they're registered, when they go to X-ray, when they have different testing done, they will be monitored electronically, and each provider will, almost like swiping a key card when they have a patient encounter, will know exactly where the patient is within the department. We'll be able to study how efficiently we're treating the patient. We'll be able to follow them from the time they enter the door of the emergency department to the time they leave the pediatric emergency department. So we're very excited about that. It will make us much more efficient. It will help us better delineate cost-effective processes with the patient, and it really is the model for the emergency department of the future.
There's a long list of quality improvements that have been or will be implemented, and in some cases, quality is critical to the survival of patients. Computer technology is driving many quality improvements. St. Alexius uses the Meditech and Pyxis computer systems for tracking patient records and prescribing and administering drugs. This reduces the paperwork and minimizes room for error.
This is our mobile Meditech computer system. We usually bring these in when we have an admission to take care of on the floor. We ask the patient or the family history questions. We also do our physical assessment. As we're examining the patient, we enter the data in here so that it's right up to the date, right up to the minute. And then we can also take them into the rooms for shift assessments and enter the data as we examine a patient in between shifts. Before we had the mobile computer system, we had to ask the patients all the questions and document everything on paper, and then go out to the stationary terminals and enter it manually from out there. So it was like double the work. You'd come in here and ask the questions and then go enter it into the computer system. These are a lot more time efficient.
The Pyxis system controls the distribution of medications. Doctors' handwritten prescriptions are scanned and sent to the pharmacy department, where they're entered into the Pyxis system and profiled or checked for dangerous drug interactions. Then Pyxis controls the dispensing of the drugs by the hospital staff via computer-controlled drawers at the nursing stations.
To get medications out of the Pyxis, first of all, I would obtain the patient's MAR, which is a sheet telling me what medications the patient needs to be taking. And I'd come over to here to my Pyxis machine, and I can just push the screen with my finger, and I type my initials. And then we have a high-tech system where I actually reads my fingerprint to make sure that the appropriate nurse is taking out the right medication. I select my patient. It has a list of all the patient's medications right now. I pick the appropriate medication according to my sheet, Unison, and I just want one of those. I hit 1, remove now, and the drawer will open up. It tells me that this is the appropriate drawer, and I lift to look into pocket 10 and pull out the medication. And once again, I'm going to check and see, make sure that I'm pulling out the appropriate vial, and that's the correct one, and I shut the drawer. And I need to exit myself out so that no other nurses can get in there right now.
Prior to installing Pyxis, medications would sometimes be shared among patients. This was more convenient for nurses administering the medications, but it was vulnerable to mix-ups and inaccurate for billing records. A variety of quality measures are regularly tracked, like infection rates and security breaches. Patients are surveyed to measure satisfaction. Pediatrics generally leads all other departments in the hospital in patient satisfaction.
Wow, thanks.
Once the basic design was in place, capacity management decisions were needed. Hospital planning specialists assisted with demographic studies and analysis to estimate patient demand.
We generally plan capacities based on the volumes of the various clinical areas. If volumes are growing in areas such as outpatient, then we certainly design facilities to create efficiencies, flows, and processes in that area. That's what we're doing now. We'd like to go to more of a medical mall approach where we get most of our outpatients to come through that medical mall entrance, and then they're easily go through pharmacy and the various areas of service that they require. I think the tendency is to get away from inpatient beds as much, shorter lengths of stay, and high technology driven services that get people home much quicker and get them well quicker.
Some factors just can't be predicted. Scheduling staff for the 3 pediatrics areas at St. Alexius is not an exact science.
The pediatric intensive care unit, of course, has a much higher acuity of patients. So they are usually staffed 1 nurse per 2 patients, sometimes even 1 nurse per 1 patient. On the pediatric floor, it depends again on their acuity, but usually it's about 1 nurse per 4 patients, and a charge nurse also who doesn't take any patients or takes a few patients. When we look at the emergent kids area, we look at traditionally how many children, how many visits we've had in the ER, and then gauge our staffing by that. It's hard to predict how many children you're going to get per night. Sometimes it's 20, sometimes it's 50, so that's the challenge there.
It'll take some time to measure the effects of the improvements at Alexian Brothers Hospital Network and in pediatrics at St. Alexius. Yet it's clear that competitive advantages have been gained. Well-trained pediatricians are always on site, and physicians with 60 pediatric subspecialties are on staff.
The physicians that are staffing our pediatric emergency section are pediatricians who either are double-boarded in emergency medicine and pediatrics, or they are pediatricians who have done a pediatric emergency fellowship, which is an additional 3 years of training after becoming a pediatrician. These are physicians who dedicate their entire professional careers to just the treatment of the acutely ill and injured child. They take care of pediatric emergencies only. They don't have office practices. They are not general pediatricians. So it's a very high level of care, and it's a very deep commitment to caring for injured children.
Efficient operations are as important in the hospital as they are in any business you can imagine. And the operations must be customized within each department and run like a hospital within a hospital. From process analysis to facility design to quality management, modern hospital operation techniques are vital to the health of a community. Now suppose you're 5 years old again, and you're feeling better, and you're so comfortable in the hospital that you don't want to leave.